So if you are having to carry them a short distance in a car seat, where should you be holding it?
Again, you want to be holding the car seat in front of you rather than down to one side. So actually lifting and supporting the weight in front of you centrally would be much better to do.
After birth, I found Pilates useful for lifting car seats in and out of the car, and using the high chairs and the push chair, lifting the babies and the push chairs.
I've had a bad back for about 12 years now, and after having 2 children it got worse. I had 2 Cesarean sections, and after the second one my back became more and more unstable, which meant that I had to go to the chiropractor more and more frequently. So I was going every 4 to 6 weeks after my second child, until I started Pilates, which was a year and a half ago now, and I've now not been for a whole year to the chiropractor, and I feel much stronger, much more stable, and generally just much stronger and fitter as a person.
So you've said about making sure you carry, if you do have to carry a baby in a car seat, to keep it to the minimum and hold them in front of you and hold them close and not hang to one side. What about actually getting in and out of a car? Because sometimes it's a nightmare, isn't it? You know, you're in a supermarket and the space is this big and you're sort of struggling to strap your child in. How should you actually safely, to look after your back, how should you safely get them in and out of car seat?
It's very difficult because that's the time when people are tempted to twist and lift at the same time.
Right.
So you really need to try and make sure that you can actually step inside the car, basically, to be able to fasten the car seat in. So safely lift the baby in, but then step inside the car to fasten the car seat itself.
So try and find a parent and child space.
Yes, in the supermarket where there is a bit more room to open the car door safely.
Yeah, which is quite difficult if you're dashing in and out, but it sounds like it's really important, this lifting and not twisting and bending at the same time.
That's the time
so if you're holding a weight, don't bend and twist. So actually get in the car and turn around to face.
Turn round to face the baby in the seat.
What about feeding and dressing and changing a child, a baby?
Feeding's another time when women are likely to start to complain of backache because it's something that they spend a lot of time doing. Certainly when you first go home from hospital with a new baby, you're spending a big percentage of your time sat feeding, and that's regardless of whether you've chosen to breastfeed or bottle feed. But it's important to be in a comfortable position. Make sure that you're sat with your back well supported, and that means using some support such as a lumbar roll is often very helpful. And then making sure that the baby's supported and lifted up towards you rather than being bent forwards.
So when they're feeding, lift the baby up.
Lift the baby up.
And use pillows or cushions or whatever.
To support the lower back as well.
Okay. And what about changing or nappy changes or dressing?
Changing, another time. You spend a lot of time changing nappies to begin with. And what you need to be careful about, it does, is not being bent over. So ideally, you may find to begin with that having the baby on the bed or something of a suitable height where you can kneel so that you're keeping your back quite straight as you're actually doing the changing rather than being just bent over would be a better idea. So
kind of to sum it up, if you like, then the kinds of things you've talked about really are about getting into good habits early.
Certainly.
And pelvic floor, deep tummy sort of static contractions can start day one.
Yeah.
Even if you can't feel much, keep doing
trying.
it. Yeah, and start with day one. And then you've talked about carrying and lifting and car seats and all these kind of day-to-day actions that women will get into the habit of either doing well or the habit of doing badly. And I guess the message is, think about it.
Think about
and
what
get
you're
into a good habit.
Certainly. Backache can be very common, and as many as 1 in 5 young and middle-aged women who complain of backache say that it often started either during pregnancy or soon after they'd had the baby, and we want to try and prevent that, obviously. And the pelvic floor exercise is equally very important because, again, as many as 1 in 4, 1 in 5 women do complain of stress incontinence, difficulty controlling the bladder. Not as common, but equally, women do also have problems, as I've mentioned earlier, controlling the bowels as well, and something we really want women to try and avoid by doing the exercises from the early days. But it's never too late to start either. So if women are thinking now, well, it's 3-6 months, have I left it too long? No. It's still worth trying to
do something about
start doing the exercise and tone up both the pelvic floor and the abdominal muscles.
Brilliant. Well, that's good news.
Certainly. But I think the thing to remember as well is if women are having problems, then they can go and get help, and not to be too embarrassed to admit that perhaps there is a little bit of a problem controlling the bladder.
Because it's quite common.
Very common. As physiotherapists, we're used to seeing this and used to discussing it with women, so it's worth them contacting either through their GP or finding out if there's a women's health physiotherapist local to where they are. But certainly within America and within the UK, then we've both got our own websites where people can contact women's health physios.
All right. Well, 15 years or more well spent. Thank you very much on women's behalf. I'm really delighted that you've taken part, really, because I think the kinds of things that the messages that you're saying, whilst they're a bit gruesome at times and, you know, a bit frank, are vital, really important. And obviously if Pilates can help women to recover, then that's just a fabulous thing. So thank you very much.
Certainly. Thank you.